Reporting live from Clovis Community Hospital. 98-year-old famed actress Betty White suffered a fractured hip after falling while dining at Prime Steakhouse in Clovis. Sources told us that she reportedly stopped in town on her way to San Francisco for a speaking engagement. The actress suffers from osteoporosis, and sources say that the main cause of her injury was from a simple fall. Osteoporosis is a disease that causes a lower density of the bones, lowering the quality of them. It also makes them more porous and fragile, allowing it to become more easier for fractures to occur. Now back to Maddie at the station to tell us more about osteoporosis and Betty's plan of care.
Thank you for the introduction. Now, what's important to note about Miss White's diagnosis of osteoporosis is that there are a lot of medical professionals who can treat her. Among the few are gynecologists, orthopedists, and general practitioners, but there's not one specific doctor that specializes in the disease. There can be a number of ways to diagnose osteoporosis, which one of my colleagues will speak about later. But there are some complications that can come from having osteoporosis, which need to be fixed with surgery and treatment. So there are different kinds of surgeries that can be used to treat osteoporosis. There's reduction surgery to move broken bones back into place, and there can also be vertebral compression surgeries. So there's vertebroplasty and balloon kyphoplasty, which both involve injecting medical cement into the vertebra that have been crushed due to osteoporosis. The disease can also be treated with bisphosphonates, which inhibit osteoclast activity. And there's also hormone therapy in case of hormone-related osteoporosis, but there are risks to that, including an increased risk for gynecologic cancers and clots in women. There's also bone-building medications that can be taken to prevent the bone loss. Other ways that can be used to treat osteoporosis are exercise to build bone mass, as well as vitamin D treatment to help with calcium absorption. And the International Osteoporosis Foundation recommends a few different medical devices to help with osteoporosis. Handrails and slip guards are recommended to be put in the bathrooms of patients with osteoporosis to prevent falling, and as well as hip protectors, which can prevent hip damage. Now on to Jessica, who will give us more information about the disease as well as the diagnostic procedures.
The timeline of osteoporosis first begins with low bone mass and structural degeneration of tissue. Over time, bones become fragile, and this leaves room for increased risk of fracture. Medical testing required in order to determine if you have osteoporosis includes a bone density test and a blood urine test. Your chances of having osteoporosis are greater if you are female, older, smaller body type, or if you have family history of the disease. Precautions for osteoporosis include low sex hormones, if you have low calcium or low vitamin D, if you have long-term use of medication, if you do little to no exercise, if you smoke tobacco, or abuse alcohol. Now Holly is going to tell us more about nutrition and other body systems involved in osteoporosis.
When it comes to bone health, having an overall well-balanced diet is important, but it's widely accepted that calcium and vitamin D are the most important when it comes to bone health. Vitamin D is crucial in helping the body to absorb calcium. Some foods that are rich in calcium include low-fat dairy products, dark green leafy vegetables, canned salmon and sardines with bones, as well as soy products like tofu. Some may need supplementation if they're not able to get enough calcium or vitamin D from their diet. Some studies connect other nutrients like vitamins A, B, C, E, and K, as well as minerals like potassium and magnesium, and other macronutrients like fat and protein to bone health. Canned feed consumption may decrease calcium absorption and should be limited in your diet. Alcohol intake should also be reduced, as some evidence shows that it may decrease bone density and lead to fractures. Osteoporosis mainly affects the skeletal system, but in some rare cases it may affect the nervous system as well. Osteoporosis may lead to compression fractures of the spine, and this can be really painful, as collapsed vertebrae may pinch the nerves that radiate from the spinal cord. Osteoporosis affects the skeletal system, and here's Roxy to tell us more about the skeletal system.
So the skeletal system has 5 main functions. The first one is the structure. The structure gives the shape and supports the weight of the muscles and organs. Without this system, it will collapse and compress your heart, your lungs, and your organs. For example, the vertebrae holds your head and the spinal cord supports your body. The second one is the movement. The muscles attach to the bone and helps the body's movement. The third is the protection. It protects the internal organs. For example, the ribs protect the lungs, the heart, and the skull protects the brain. The fourth one is the blood cell production. The bone protects blood cells from the red bone marrow. It also protects the white blood cells and platelets. The fifth one is storage. Bones store minerals such as calcium and phosphorus to make the bone hard. And bone marrow can store energy and lipids. So now moving on to the pathway that osteoporosis affects the skeletal system, we have a picture right over here. So let's zoom in and explain more.
Alright, so there are two organic matters. The first one is osteoclast. Osteoclast is the bone resorption cell. There is this hormone called parathyroid hormone, which it regulates the osteoclast. Parathyroid hormone, it breaks down the release of calcium and phosphorus. Both of these go into the bloodstream. Another organic matter is osteoblast. Osteoblast is basically the bone-forming cell. During menopause, there is this hormone called estrogen. Estrogen is embedded in the osteoblast. Estrogen has two components. One is the energy metabolism and energy regulation. So, if you have low levels, it will affect these. It can lead to more brittle bones, so fragile bones. It can break under pressure, and it's more common in older adults. Fractures in the hip leads to immobility, and this is how you get osteoporosis.
Viviana is going to elaborate more on the body system and parts.
The bones are living, growing tissue made up of many parts. To start, they have two main forms of osseous tissue, compact and spongy bone. Compact bone is dense, located in the walls, and it provides protection and strength. As you can see in this image, the compact bone is located in the more outer portions of the bone making up the wall. Spongy bone is an open network of trabeculae in the inner layer of the bone surrounding the medullary cavity, reducing density and allowing it to compress. Spongy bone is more common within the inner portion of both the distal and the proximal epiphysis, as you can see in this image. The medullary cavity, or middle of the bone located here, contains yellow bone marrow for energy reserve and red bone marrow for blood cell formation. Important cells that can help the bone grow and develop include osteoblasts, which secrete matrix and fibers to form parts of the bone, osteoclasts, which dissolve fibers in bone matrix, and osteocytes, which help with the maintenance and turnover of mineral content within the bone. Osteoblasts and osteoclasts are present and active throughout life, and it is the decrease of osteoblasts activity in older age that can help contribute to the weakening of bones, therefore leading to osteoporosis development.
Osteoporosis has a major impact on society, with 1 in 3 women and 1 in 5 men worldwide experiencing osteoporotic fractures over the age of 50. This can affect quality of life and well-being, resulting in things like pain, disability, reduced mobility, and have an impact on independence. This can impact our society with large medical care costs, as well as adults who are still working, missing work days and income from missed days due to osteoporosis. For more information on osteoporosis and its prevention, visit eyeofbonehealth.org.